If you've been following along with this 3-part series about low back pain and SI joint pain during pregnancy, you already know what to stretch and you know what needs to be strengthened. But I'm hearing some of you say, it still hurts. What am I supposed to do in the meantime? My name is Dr. Nicole. I'm a physical therapist and a mama, and today I'm going to give you 2 less tips about things that you can do if you're still having back pain and you've tried stretching and you've tried strengthening. First tip I have for you, if you've started stretching and you're strengthening, but you're like, I still need to work my 12-hour shift at the hospital, and what am I supposed to do? So here it is, SI belts. They can be super helpful in managing that SI joint pain and back pain. Some tips about how to wear these belts is you want to try to make sure they are below your ASIS, which if you're not sure what that is, think about the hip bones in the front of your belly. I'm gonna show this picture here pointing to the ASIS. They wanna be below that, which is probably pretty obvious because you don't want it over like your belly button in the main part of your belly, squishing baby. You want it below that. You also want it to come across your pubic symphysis, that pubic bone in the front as much as possible. And then you want to make sure that this belt isn't being worn super tight. Tight isn't always better. In fact, it can actually be worse. If you really tighten it up, you might experience like you feel faint, you feel lightheaded, you're getting really hot and flush. This probably means you are cutting off circulation somewhere and you're having these symptoms because it's too tight. You need to loosen it, and tighter doesn't make it work better. The other key with these kind of belts is to put them on in a laying down position. So kind of get the belt under your hips, lay down, align it where you need to, and then connect it. And then go ahead and stand up, and if it feels comfortable, good to go. You can always adjust it a little bit if things have changed as you stood up. The other thing with them is they are really not meant to be worn 24/7. They're one of those things that you're wearing to manage pain, but you're not wearing them as a crutch. You want to work on the strengthening and the stretching to really get to the bottom of the problem rather than just wearing this belt all the time, because it could lead to more weaknesses and imbalances that could actually increase pain in the long run. The other thing with this belt is if you put it on, you wear it, and you're like, that did nothing, it might not work for you. If it's going to do something, it'll do something. If it's not, it's not for you. So don't think, oh, like I'm not wearing it right. Maybe this belt just isn't providing you relief in the way that you need it. The second tip is sometimes just general information about what to do with low back pain isn't enough. Sometimes you need a one-on-one consult with a physical therapist. You could do like a telehealth appointment or an in-person appointment so that the therapist can really walk you through, okay, is this particular hip muscle tight? Is this particular muscle weak? What does your pelvic floor look like specifically for you? Here is a very specific, unique to you plan that you need to work with. And the other thing is they can do manual work to try to get really tight muscles to relax. They can teach you, your partner, different ways that you can work on those pain points. And sometimes this is really necessary if you're like, I'm in a lot of pain right now and I don't even think I can continue working like this. Sometimes the manual work is needed to bring those pain levels down. So try to get in touch with a women's health physical therapist who can walk you through a specific plan for you. So there you have it. Those are my last 2 tips about how to get through pregnancy, especially the 2nd and 3rd trimester, with managing your back and SI joint pain. Give those belts a try and get in touch with the physical therapist if these general tips aren't really working for you, because I think there is a little bit more that someone could offer you with a one-on-one session. I would love to have you subscribe to my channel if you like videos about pregnancy and what to do during labor and delivery and how to have a good recovery after you have your baby. And give me a thumbs up if you liked or learned something in this video today. Thanks so much for joining me, and we'll see you all next time.